If you have a question for Dr. Donna, please do leave it on my page and I will be happy to answer the question for you. Hi, good evening, everyone. If you ever had one of those days where just like everything technologically just did not happen for you, well, welcome to today. That is today for Dr. Donna. But thank you so much for joining. Thank you for keeping your appointment. You know you have an appointment every Thursday at 6:30 p.m. with your doctor, Dr. Donna. So thank you for joining. Thank you for hanging in there with us tonight. I know we started a little late, so I'm hoping that you're able to still come on. As always, we're live, and you know, with anytime you go live, there's always a possibility that something just might not click like it should. But we're here. And as always, we are able to take questions and answer questions. So tonight, I hope if you have any questions that you will put them in the chat and I will do my best to answer them. So, you know, here at Talking with Dr. Donna, our goal is to build generational health. That means that we are going to focus in on our 4 pillars, right? Our physical health, always paying attention to our physical health. We're paying attention to our social and emotional health. We are paying attention to our spiritual health. And finally, our environmental health, because those are the 4 pillars of generational health. If we take care and pay attention to each and every one of those pillars, then we are going to be able to have generational health. That means that we end that cycle of premature death, particularly in the Black community. I really, by the end of my lifetime, I don't want to see African Americans at the top of every single disease list. High blood pressure, diabetes, obesity, heart disease, you name it, cancer, we're there. I don't want us to be there by the end of my life. So let's all think about that and focus in on that. As you know, we're here again every Thursday at 6:30 on YouTube. So if you are not yet a subscriber, I'd really appreciate it if you went over to YouTube. Go ahead and hit that subscribe and then the bell icon so that every time I go live, you will know it. This is season 2. This is season 2, and I'm really excited about that. So if you hear anything tonight that you thought was worthwhile, then I would really appreciate you to subscribe, hit a like, share the page, share what we're talking about so that everyone can be on board. All right. Hey, good evening, Ricardo and Liz and Sharice and Annette. Good evening, good evening, good evening, good evening to all of you out there who are watching and just haven't said anything yet. Okay, so what are we going to talk about tonight? Tonight, you know, we're going to talk about Alameda County. We're going to do COVID updates tonight. And we're going to talk about some things that I really think that you all should know. There's lots of things that have been happening this week, and I want to make sure that you're aware. So first, we want to start about where we are here in Alameda County. So we're going to talk about Alameda County and where our statistics are here in Alameda County. We always look at what we're doing in terms of age, and we look at what we're doing in terms of race and ethnicity, right? So if you look at our total cases, we're still rising, right? So the Delta variant, which is the variant of the most concern, and that is the most widely spread. We'll talk about variants in a little bit. But when we think about looking at our data and our numbers, we're still having people who are getting coronavirus. And unfortunately, we are still having people who are dying from coronavirus. So we're not out of the woods just yet. Our data, if we go to the next slide, by race and ethnicity hasn't really changed. We are still looking at Black folks being the most impacted and Latino folks being the second most impacted. And when we think about those looking at our vaccination rates, lowest rates remain in the African American community. So there's really no mistake there, right? That we have the highest number of cases and our vaccination rates are the lowest. There's really, there's a correlation there, right? Because we know vaccines help to protect you from getting coronavirus. All right, that's where we are. Hi, Michonne. All right, so tonight we're going to talk about what we need to know. Lots of things, like I said, happening in the news. And so we're going to just go through a few of those things happening to get you caught up to what you may or may not already know, and to kind of give you some advice and some information about what you think that you might already know, making sure that you have the best information, right? That's what we're about, best information. So number one thing that you need to know, we're going to talk about variants. So I know you have probably heard about variants in terms of alpha, beta, gamma, delta, and now we have this new variant called Omicron. But let's just stick here for a minute and talk about these variants. So these variants have been called variants of concern. So you might have heard that phrase in the news about what is a variant of concern. A variant of concern means that it is a variant that is infecting people in multiple places. We've had at least these 4 variants and probably even more. And what makes a variant of concern? So variants are caused by the mutations within the virus itself. So when the virus gets into your body, it infects your body, and then it's millions and millions and millions of copies of itself. Well, if you can imagine, as you're making copies of yourself, you're going to make a mistake. There's going to be a little glitch here. There's going to be a little glitch there. It's going to be little glitches that cause what we are considering variants. So variants are happening all the time. But some of these variants actually catch on. Some of these variants are smart enough to kind of evade dying off that they can become infectious. And so then you have this virus with a little bit of a change that now is causing infection. So the variant of concern is that this change that the virus has made to itself has made more people sick. And we know that the current variant that is still, despite the newer variant of concern, Omicron, that's out there, the variant that is still overwhelmingly causing the most infections is the Delta variant. That still remains. Now, Omicron is a new variant, and the reason that this new variant is causing a little bit more of a heightened anxiety and getting a little bit more attention than the other variants is because those variants had very few changes to the actual virus, mostly to the spike protein. Very few changes. But Omicron has multiple changes. It has in the 50s number of mutations or changes to the protein. Now that is causing concern because it's saying, does that mean that it's going to be able to jump from person to person a lot easier? We don't know yet. It's kind of still too early whether or not it's easier to get coronavirus from this new variant. Is it going to be even more dangerous? We kind of don't know that yet either. Now, early reports, if you looked at the people who have been infected with the Omicron variant, their symptoms have been mild. And the majority of those people who have had the mild symptoms have been vaccinated. So does that mean that the vaccine does or doesn't work against the Omicron? Again, it's a little too early for us to really have a definitive answer to that question. What we know now is that there are at least 57 countries where we have seen Omicron. Now, that still doesn't mean a whole lot. It means that people are getting infected with it, but does it mean that it's going to take over and become even more infectious than our Delta variant Is it going to become the dominant variant? Is it going to evade our vaccines? Too early. So more to come. We're just going to continue to watch this variant. Number 2 that we're going to need to know, boosters. So going hand in hand with our virus, creating more mutations and getting kind of changing, we know for sure that if more people are vaccinated, then that prevents the virus from being able to make those millions and millions of copies, because your body already has a defense. The soldiers, you've heard me talk about this. The soldiers are already on their job. They're lined up. They're ready to fight the battle. So when the enemy, which is the virus, gets into your body, if you have the vaccine, your body's already prepared. You got that front line, you got the Army, Navy, Air Force, Marines, they're all ready for that virus when you are vaccinated. So when the virus comes into your body, it doesn't have the ability to make millions and millions of copies because your armed forces are there ready to battle. When you don't have the vaccine in your body and your body sees that virus, then your body has to take the time to build up its immune system. It has to say, wait a minute, what is that? It has to recognize that there's an enemy, and then it has to get all of its troops up together. And that's what gives the virus time to make multiple millions and millions and millions of copies. That's why we are really pushing for people to be vaccinated, because we know that when you're vaccinated, you have less chance of allowing these viruses to create mutations, and that also prevents you from getting super sick to the point where you are hospitalized or even die from the virus. That's why we have the vaccine. What we knew from the very beginning is that we were going to need boosters. And what we thought was, do we need a booster every year, like the flu vaccine, or are we going to need boosters more often? Well, right now we're saying if you have had your first dose, if you had Johnson & Johnson, or first 2 doses, if you had Pfizer or Moderna, if it's been 6 months since that second dose, then you're probably time for you to get a booster. So the question then is, well, if it's okay for me to get a booster, which booster should I get? Should I get the same booster of the same shot that I had, or should I get the booster of a different shot that I had from what I had the first time? So luckily, scientists are always looking around and trying to figure this stuff out, because they know you're going to ask these questions. So they try to figure these out. So they have done this study, and this study was reported in the Wall Street Journal. And what it did is that it looked at what was your first shot. Was it Johnson & Johnson, or did you get the 2-dose Pfizer or 2-dose Moderna? And then depending on which vaccine you received, what did it look like if you got a booster shot from the Moderna, or a booster shot from Pfizer, or a booster shot from Johnson & Johnson? And it compared the antibody response. Right, that's your body, right, building up its soldiers. How did your soldiers line up and attack, and with what kind of, armament, how did they come armed? Did they come armed with a little bitty pop gun, or did they become armed with, like all kind of machine guns and AK-47s, and they was, grenades and big rocket launchers? How did they show up in the body in terms of your antibodies? So let's look at this. When you look at Johnson & Johnson, they did the initial shot of Johnson & Johnson, and then they said, okay, if we get a booster shot of Moderna, what did that do to your antibody response? And it said it boosted up or increased the antibody response by 76 times with the Moderna. With Pfizer, it did another big immune response, but only 35 times. And if you gave a booster shot of someone who had the Johnson & Johnson with the Johnson & Johnson, it really only boosted to about 4 times. So what is this saying? This is saying that, again, this is only after about 2 weeks, and we don't know long term, but we can pretty much extrapolate that if it happened after 2 weeks, it's probably continuing on for at least the next 6 months, that if you have the Johnson & Johnson vaccine as your first vaccine, you're probably going to get the best boost of your immune response if you get the Moderna vaccine. okay, as your booster. That's the conclusion. So let's look at the next vaccine. So then they looked at Moderna and did the same comparison and said, if you got the Moderna the first time, what happens if you got Moderna for the booster? And what happened if you got Pfizer for the booster? What happened if you got Johnson & Johnson? What is the conclusion here? If you got Moderna as your initial vaccine, then you can, you should probably, the Pfizer and the Moderna by one time, probably not that big of a deal. You could go either way. I personally got the Moderna vaccine and I did the Moderna booster. But between Moderna and Pfizer, you're going to be in great shape either way. All right, let's look at Pfizer. If you got Pfizer for your 2 doses, then it looks like, again, the better of the vaccine to boost up your antibodies is to go with Moderna. Go ahead, Dr. Corbett. You go ahead and get that vaccine done, girl. You did it. Moderna vaccine. Kizzmekia Corbett, one of the main scientists who worked on the Moderna vaccine. Black girl magic. Love it all day long, all day long. So that is the boosters. That means it's time for you to get a booster if it's been more than 6 months. And based on this particular study, it looks like you're going to be the best to get that Moderna as your booster shot. All right. The other thing about boosters is that you may have heard in the news that today the FDA gave emergency use approval for 16 to 17-year-olds to get a booster shot. So right now we were, prior to today, only 18 and above to get a booster shot. But now the FDA has given emergency use approval if you're 16 or 17 that you can get a booster with Pfizer. All right, that's your second need to know. Number 3, let me see. Let me stop and see if there's any questions so far in the chat. No, hello everyone. No questions yet. All right, so our third one. Let's talk about, what's number 3, Sita? Thank you, Nog. All right, let's talk about OUSD. So our OUSD, you know, if you are a student in Oakland Unified School District, there is a vaccine mandate. We talked about this a couple of weeks ago, that vaccine mandates, first and foremost, are not new in the state of California. Anybody who has a child knows that you have to have certain vaccines in order for your child to go to school. Measles, mumps, rubella, hepatitis, chickenpox vaccine, right? So vaccine mandates are not new. So it should not be a total surprise that we are mandating vaccinations with the coronavirus, right? Because anytime you have a virus that is easily spread and that virus can cause so much damage to cause your child who is just minding their own business sitting in the classroom next to another child who might be infected, that your child minding your own business could potentially get so sick that they go to the hospital or that they die. Now, when that is the situation, schools say, oh, no, 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 not here. We got to protect our kids. And that's when we do a vaccine mandate. So OUSD has implemented a vaccine mandate and it goes into effect. Initially, it was the very first part of January. They're given a little bit more leeway because we understand that you parents have questions about the safety of this vaccine. It's understandable. So because we know you have questions, we want to make sure that we get all of your questions answered and that you feel good about having your child vaccinated. They have extended the mandate. So now the mandate goes into effect January 31st, 2022. Now, even though I completely understand the need for the vaccine mandate, I've always said, now for those parents who decide to opt out, I hope that OUSD, I hope you're out there listening and you hear me. I hope you have a great plan for those children whose parents are going to decide not to get the vaccine so that their learning is not impacted. Okay? OUSD administration officials, I hope you're listening. All across this state in California, I hope you're listening. Make sure that these babies do not fall behind because of the parental choice to not have their children vaccinated. All right, so that is number 3. Number 4, we are going to talk about the ban. Okay, I'm going to get on my soapbox. I'm already on a little bit of a soapbox, so it's kind of perfect tonight. But I wanted to just talk a little bit about the ban because it irritated my spirit. I was on vacation and I heard about this travel ban and I was like, why are we banning travel from South Africa? So like I said, we know that the Omicron has been found and isolated in over 57 different countries. But we have a ban on travel from South Africa. And I find that awfully disturbing. And I find that racist. Let me just put that out there. I find that racist, United States of America, because South Africa did what they were supposed to do. They found that there was a number of people who were being infected, and they sequenced what it was that they were being infected with and found this mutation, and they found Omicron. Now, the Netherlands had done this back in November. They had discovered that some people were getting infected and they thought it was a little weird, it was a little different, and recognized that it was not Delta. But they didn't say anything. They didn't tell the World Health Organization, and it wasn't sequenced. It wasn't sequenced until South African doctors sequenced it, identified it, and said, hey, this is a new variant. And because of that extra effort and because of that work, that brilliant scientific work, they are now being penalized with a travel ban. And what that is going to do is it's going to prevent other countries from coming forward to say, hey, we have isolated this new variant. That's dangerous. That's a dangerous precedent that the American government has just set, because if we don't know that there's other variants out there, we don't know how to necessarily protect ourselves. So we don't want this to continue to happening. And I think that the United States should have already reversed this travel ban, but they haven't. So I'm just saying here on Talking with Dr. Donna, I'm irritated, I'm angry, right? As we say in Save, I feel violated, right? So just wanted to let you guys know, to give you a little something to think about when we think about, this pandemic. And we've talked about the racial disparities in the very beginning of this pandemic, right? When people were getting infected, and we knew that it was going to be the African American community that was going to be hit the hardest. Turned out to be true. Then we said, all right, well, we need to make sure that we have these treatments that are going to be available in the African American community. We need to make sure we have the vaccines available in the African American community. And to the government's credit, they responded, and they have sent FEMA units to multiple places in communities across the state and across the nation to make sure that communities of color had equal access to the vaccines. Now we need you to see, as we're moving out of this phase, right, of the vaccines, right, is looking at what is going to happen right now in this inequity of the virus in terms of schools, right, because we know these vaccine mandates are going to come down, in terms of places that you're going to be able to go, because more and more places are going to say you can't enter unless you're vaccinated, right? Restaurants are already doing that. Now we're moving into schools. Is that going to create more inequity in our community that already, where inequities already exist? Pay attention, folks. You've got to pay attention, because this is, this is subversive sometimes. Sometimes you don't really recognize what's happening. But if you don't get on board, you're going to be left behind. And that is not saying get on board with something that's unsafe, but that is to get on board with what we have shown and have demonstrated to be safe to help to prevent you from getting sick. All right. Next, final need to know. Wait, there's one more, Sita. One more need to know are the new COVID treatments. So I'm going to just stop here at number 5, COVID treatments. So there was a new report that there is a new treatment that is preventative, right? So we have had a couple of treatments, right? If you get really sick, you go in the hospital. There is medications that they give you in the hospital to help to protect you from getting more sick from COVID. We know that we have vaccines, that vaccines are also to help prevent. But now there is also this new medication that is going to come out that is also preventive. Now, this medication is specifically for immunocompromised. That is how they want to market it, for those people who are unable to get vaccinated. So these are people who are either receiving chemotherapy, right, who have HIV or AIDS, or are on long-term steroids, right? People who couldn't get the vaccine or who the vaccine didn't work well for them. So instead of the vaccine, they have now created this medication, which is made out of monoclonal antibodies. It's kind of a cocktail, 2 different antibodies put together in this one treatment. And it is meant to be preventative. Now, the study was kind of small. It only had about 5,000 people in the study. And most of these people, though, that were in the study had a condition that put them at high risk to get COVID. So they had diabetes, they had obesity, they were immunocompromised. So the vast majority of the people in this clinical trial that they did were high risk, and a very small number were those who were immunocompromised. But what they showed is that when they gave them this cocktail, that it gave them about an 84% protectiveness, right, against getting super sick from coronavirus. So not as great as the vaccines, right, because we know that our vaccines are closer to the 94, 95%. Even with this Delta variant, we're still in the 90s. But with this new medication that is just got approved from the FDA, there's a potential to get into the mid-80s in terms of being preventative from getting COVID vaccine. So that's the treatment there that is on the horizon. So that's good. The good thing about science, right, is that as we know more, they're able to do more. So for those who are not able to get the vaccine, there's potentially this other medication that will become available. Now, it's supposed to be free, right? It's supposed to be free because we're still in the middle of the pandemic, but there may be a minor charge if you go get it at a hospital versus getting it at a clinic. So we'll see how that all pans out when they start to distribute it. And again, we're going to be looking to see if they're going to distribute it well in the African American community, since we are the folks that have the highest risk and those high risk factors. We're going to make sure that it's in our community. All right, so keep your eyes open. That's the last thing that we're going to talk about tonight that you need to know of what's going on in the world of coronavirus this week. Questions. Let's see. Dr. Donna, do you think we'll need to get another booster shot in 6 months? Oh, that's a good question. When you looked at this new medication that I just talked about, they're thinking that you're going to have to take it every 6 months, right? Because your antibodies over time start to, right, your little soldiers get a little tired on being on the battlefield. They want to rest. They want to get some, lay down and rest. And so you need a boost. And so because this medication is saying every 6 months, they're going to probably need to re-up this medication. You're going to have to take it every 6 months. My thought is that we're going to need boosters somewhere between every 6 months to a year. And again, that is all going to depend on mutations and what's going to happen with the virus. The more people we have vaccinated, again, the less we're going to give the virus the opportunity to mutate and create variants. So the answer to that, Sister Liz, is I do not know if it's going to be 6 months, but I think that it is at least going to be every single year. All right. Hello, everyone. I see you out there saying hi. Anyone else have any questions? I'm looking. All right, somebody is on my page today talking crazy. Who is that person? I need to block you. Talking crazy. I hope you're probably a bot. All right, so let's go to our food of the month. So you know that this season we've been really paying attention to our diet and really wanting you all to think about how to incorporate foods in your diet that is going to be healthy for you. So our first food of the month, we did kale. Yummy, yummy kale. I hope you did some great recipes with kale over the last few months. And then we had our food of the month, which was squash. And so I hope that you tried some new types of squash. So you tried spaghetti squash. I know Elisita said she made some spaghetti squash. I can't wait to taste it and see how it is. So let us know when you're trying our foods of the month with our recipes. Go to @MyDrDonna or hashtag TW Dr. Donna or @Talking with Dr. Donna and put your recipes there and how you are using our food of the month. Well, we're in December. That means it's time for another food of the month. And one of my favorite things to do and eat during the holidays is dressing. And you can't have dressing without cranberry sauce. And a few years ago, my brother, who you all met on the episode of Growing Your Own Food, really taught me how to make cranberry sauce from fresh cranberries. Amazing. Thank you, Tony. But our food of the month, cranberries. And why cranberries? Look at this. Are you guys seeing this? Can you see this? Do you see how many vitamins are in this little berry? This cute little red berry is so many vitamins. Vitamin C, folate, vitamin A, E, K. All of those vitamins, A, E, K, really help your body to do its job of digestion. So you really want to make sure you have those vitamins working for you. It helps with your blood clotting. So many different functions of our vitamins. But cranberries are jam-packed with vitamins. It's jam-packed with mineral and proteins and calcium and iron. So many good things. So this month, I want you to experiment and think about cranberries, right? It's also a good source of the antioxidants. It slows cancer progression, reduces inflammation. And you might think, well, what does that mean? Okay, well, we know inflammation is a precursor to many of our diseases like asthma and heart disease and cancer. So eating cranberries is going to help to reduce that. So also, remember your mama and your grandmother used to always say, drink some cranberry juice whenever you had a UTI? Well, it's actually true. It does reduce the incidence of UTIs. But you got to drink or eat the good stuff. Not cranberry juice that you get in that center aisle there. Because if you look at the number of carbs or sugar that's added to that, it's unhealthy. Sorry. So you got to go get that fresh cranberry juice that you get from like a Whole Foods or some sort of organic store. So pay attention to the amount of carbs that's in there. But drinking a glass of cranberry juice every day can really be beneficial for you. Adding some fresh cranberries to your salads, making your fresh cranberries as you make cranberry sauce. Many different ways in which you can make cranberries, but try to incorporate it into your diet this month. We'll try to give you some ideas and some recipes so that you can think about how you can use cranberries in some really great ways. So think about it. That's our food of the month. Yummy cranberries. Yay. All right, y'all. Well, that's it. That is our show tonight. I hope that you learned something. Again, if there's anything that you took away that you like, that you're going to share this segment with your friends and your family, make sure you go to YouTube, subscribe to my channel, Talking with Dr. Donna, and hit that bell icon so that you know whenever I go live. Tell a friend about this show and say, hey, what do you do on Thursday evenings? Well, I have a doctor's appointment every Thursday at 6:30 Pacific Standard Time. So keep your appointments. Thank you so much for continuing to watch. I hope and pray that you take care of yourselves, that you take care of your loved ones. If you have any questions about the vaccines themselves, look on some of my previous episodes. I've done lots of episodes about the vaccines and about the virus, so you can get some of your questions answered. In the meantime, take good care of yourselves. Remember, we're building generational health, starting with you right now. So until next week, at your doctor's appointment at 6:30 p.m., see you then. Take care. Clear? If you have have a question for Dr. Donna, please do leave it on my page and I will be happy to answer the question for you.